Good evening and welcome to I'm Listening Live. I'm Listening is a 24/7, 365 initiative that works to destigmatize mental health. We are still in the thick of things. 2021 promises a different year, but there are some things that are being carried over with us from the year before. So I want to remind everyone to continue to center and prioritize your mental health. Everyone is talking a lot about physical health, and that's very important, but mental health has to be part of a discussion or definition when we're talking about general health. And that's going to mean taking time to self-reflect, focusing on self-care, maybe getting into some therapy, but also talking about your mental health. And when someone comes to you talking about their mental health, you don't necessarily have to fix it or cure it. Sometimes people just need someone to listen. So be that person. And maybe take some time to reach out to some other people that you haven't heard from. Everyone is going through this, and we don't want people to feel isolated and detached. And now we're going to go to our first guest, Dr. James Simmons. How are you? Welcome back to the show.
Thank you very much. I am doing all right, Chris. How are you?
All right. To be honest, doing as best as I can, being honest with what my struggles are. It's been a rough week. It's the intersection of a lot of different things, but focusing on my self-care, it's kind of all we can do right now, right?
Absolutely. I agree. I just came off of 8 days in a row at the hospital. And so I've been trying to be really forward and frank and honest about my mental health with folks as well. Like, I'm okay today. Some days I'm not. You see a lot. You can only see so many people getting so sick for so long and unfortunately dying before it really takes a toll.
That's real. That's real. And for people that aren't encountering that as much, I can't even imagine. So thank you for everything you're doing to help us with this right now, truly.
Of course.
So let's do some COVID updates. A lot of people have been made very anxious looking at all the stories about the UK strain. What is it we need to know, and what kind of perspective should we have on that?
Yeah, there's B1111, there's L452R. Cedars-Sinai announced that there's a new strain in Southern California, which could be related to the surge of cases that we had here in Los Angeles County. That one's called Cal20C. So you hear all these things, you hear all these numbers coming out, and they can be really scary. I think the most important thing to remember about this is that we are doing some fantastic genome sequencing on the virus to find these variants so that we can trace them better. Ultimately, this helps us slow down the virus and continue to make sure that the vaccine is going to work with these variants, which it's very, very important to note right now that even though the mutations of this virus are happening on that spike protein where the vaccinations work, we have all the evidence points to the fact that the vaccine will still continue to work against all of these variants so far.
Okay. Thank you for saying that. I mean, that makes my anxiety levels drop because I think people read the headlines and they think, uh-oh. And it's like, yes, however, what you just said. Good. Because I think part of the problem is when we talk about mental health is people getting misinformation or not understanding the information. So sticking with that, one of the things I'm hearing people talk about is can't wait to get the vaccine because then I can just do whatever I want. I can throw my mask away, hit those dance parties. Talk to us about what we need to know post-vaccination about the possibility of infectiousness.
Oh, man, I want to go dancing, too. I want to travel so much. It's killing me. It's tough. But we all have to continue to do our part. This is, if you're a sports person, this is that analogy where that fourth quarter analogy comes in,
Okay, you already lost me.
Did I lose you already? Right. I'm trying to think of another
Use
analogy.
a food metaphor. I like food metaphors.
Oh, okay. Very good. So this is one of those where I'm trying to think of a good food metaphor for you to complete the dish, right? Sometimes you can make it and it looks great, but presentation is everything. So if you're going to present this meal to someone, how you plate it, the garnishes that go with it can really just top it off. We're there. We are close with the light at the end of the tunnel. So for those of you getting vaccinated right away, hopefully everyone's going to get vaccinated soon, but I know it's taking a while. You still have to wear your masks, and here's why. Because we know that the data is overwhelmingly positive that this protects you from getting very sick with coronavirus if you get vaccinated. What we don't know yet is how contagious would you be if you're fully vaccinated and you get coronavirus, but then are you still contagious to others? We don't fully know that yet. So you can get totally vaccinated. You might even get coronavirus. You're likely not going to get very sick from it because you've been vaccinated, but you still might be able to pass it on to others. So no kikiing, no big dance parties as much as we want to, not yet until everybody gets vaccinated.
Okay, thank you for clarifying that, because I think that's what made me nervous when I was looking at the research, is people thinking I get my second shot and I'm good to go, and it's like, well, hold on, no, you still have to follow some of those precautions. So does that basically mean, though, then we have to reach a certain level of vaccination for us to be able to return? Like, what is the goal line that we're trying to get to?
Sure. So everyone's been talking about this term herd immunity for a really long time, right? Well, that herd immunity place happens somewhere, depends on who you ask, between about 65 and 75% of all individuals, so I'm talking like across the globe, have either been vaccinated against COVID-19 or have been exposed to it. So then their body knows how to react to it. So it's a combination of individuals who have gotten COVID-19 and recovered from it, so their body knows how to react to it, and other individuals who have been vaccinated. When we get to, let's say, to be safe, somewhere around 75% of the entire globe reaches that, we hit this herd immunity place where the virus just can't live anymore. I mean, viruses don't live, but it just doesn't have vectors anymore. It starts to die off. We're still a very long way away from that right now.
Womp womp, but good to know, truly.
Womp womp, yeah.
And then, unfortunately, there's now something else emerging called post-COVID syndrome. What does that mean?
Yeah, so you're seeing cases of this all over the world right now. In fact, there are hospital systems in New York that have opened post-COVID syndrome, or the Center for Post-COVID Care. It's because people might get sick from COVID. They get over that acute phase, those couple of weeks where you just really feel awful. But then there are signs and symptoms that linger on for a really long time. People talk about this really, really intense fatigue, that it's difficult for them to even get out of bed, to go back to working out like they used to. There's a brain fog associated with this that is reported almost across the board. There are other, muscle pains, nerve pains that happen, all these different things that are directly related to COVID and its horrible effects on the body that linger in people now for months and months after they got over sort of that acute phase. So even if you're young and healthy and you're like, I'll be fine, I can get COVID, I'm strong, I'm fine. First of all, we're finding lots of younger people are getting sick and dying from this, unfortunately. And second of all, even if you do get over it, there's the potential that you might have long-term symptoms.
All right. So we got to still keep protecting ourselves and protecting those around us, right? Because it's not just looking out for ourselves. We're also trying to build in that keyword empathy and worry about how we're impacting others. Dr. James Simmons, thank you so much for being a part of our show.
You are welcome. Someday, Chris, I'm going to come on here and we're going to have a really happy conversation.
I can't wait. I really can't wait. Every time you come on, we're dropping that dark truth. It's important. But
I'm the harbinger of of doom every time I come on. That's all right. This is good information for people to know. And like I said, stay firm. We are almost there. Stay. We can do this, y'all.
Have a great night.
You too.
All right, I know that wasn't exactly what everyone wanted to hear, but it's important that we're facing reality and knowing the facts. We still need to look out for the impact we have on others, because even if you're willing to take certain risks, we don't want to infect those around us. All right, let's now go to our next guest, Heather McPherson, licensed therapist and also CEO and founder of the Sexual Health Alliance. How are you, Heather? Welcome to the show.
I'm good. Thanks so much for having me on.
100%. So right now we're seeing a lot of people, they're talking a lot about their drug and alcohol use. I talk on the show sometimes about the difference between self-care and coping mechanisms. The way I tend to break it down is self-care are things that have a beneficial impact on you, where coping mechanisms are literally anything you might use to regulate yourself. Are you seeing in your practice a spike in the use of drugs and alcohol during the pandemic?
Yes, absolutely. Specifically with men. I think with dry January, maybe some people are cutting back, but I definitely have seen a spike. And then I've also seen people even drink with it in session, which of course I have to say, wait a second, that's not okay. We shouldn't be, we need to have some boundaries and some, guidelines for how we run therapy sessions, and blatantly having a beer during session is absolutely not productive and helpful to our work together.
Yeah, very interesting. I guess people get very comfortable being at home all day. Yeah. And also yeah. I've seen online people talking about, it's 5 p.m. somewhere, even though it's 10 a.m. where they are. And so at first I think I was laughing, and then I started to think more clinically and therapeutically, and I thought this could actually lead to a lot of problems as people are spending their day drinking, and what happens after the pandemic, and we know with alcohol use it leads to sometimes domestic violence and other issues. So we had to wind up going on to telemedicine, which I initially kind of wasn't a fan of. I've never enjoyed that. Now I've found a lot of value in it. Are you seeing clients using online programs and 12-step meetings to help with their drugs and alcohol use?
I'm seeing a lot of clients embrace the online atmosphere and get really comfortable with it. As you said, I feel like there's an opportunity to create a little bit more of an intimate environment where you can see inside their bedroom or see their nightstand or see, their desk or their office. And that can provide a lot of insight into how they're living their lives day to day. I'm also seeing a little bit of a little bit of a question of, well, when we're in in-person therapy, we can see more of what's going on in terms of like smelling the breath or how they're walking, and sometimes it's easier to pick up on if they're actively using or drinking. Online you don't really have that insight, and you can't really smell, obviously you can't really see how they're moving and how they're behaving as much, and so that's a little bit of a barrier, but I think overall it's been really great.
And I think it's hard to separate out what might be a response to the pandemic versus what is an actual shift in their relationship to drugs and alcohol. So I think it's like, on one hand, I'm trying to tell people, like, take it seriously, because you don't want to come out of this time with some new issues and struggles. But at the same time, I'm holding it loosely a little bit, knowing that people are in isolation, they're hyper stressed, they're trying to both work from home, they have kids that are going to school from home. It's a lot.
Yeah, it's as you said in the beginning, I think coping skills come and play hugely here, and being able to self-regulate is a really important concept to understand and practice. Whenever you're home all day, every day, you can literally just go downstairs and grab a beer, and no one's going to see you. No one's going to notice. There's not that social accountability, and I think that is what's probably contributing to the increase in drug and alcohol usage. And I think that having that access to online treatment programs and therapy can be really helpful right now, specifically when people are maybe in rural communities where access to care, access to high quality care isn't available. So it's kind of a double-edged sword that I'm seeing.
Yeah, and I like what you said about people that are in rural areas. Right now, a lot of states have relaxed whether or not a therapist can work with someone outside of their current state. So I advise everyone, do some research, Google, find a therapist. You can find a therapist these days in another state because of the law shifting a little bit, 12-step meetings. And also, before we let you go, let's do a quick little plug. If anyone's looking to do a little training, some education, maybe around sex, where maybe can they go?
Well, that would be sexualhealthalliance.com. We have full online training programs in sex therapy, coaching, educator, and counselors. So medical providers and therapists and coaches all can get fully trained online 100% for the next year through sexualhealthalliance.com.
Bam. Heather McPherson, thank you so much for being a part of our show.
Thanks so much for having me.
Have a great rest of your night.
You too.
For those that want some more resources, we're going to put some up at the end of the show. We'll be back next week. And as always, thanks for hanging out with me. And you all have a beautiful, beautiful rest of your night.